Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today I wanted to talk about getting out your crystal ball for your patients who are ages, say, 2 through 5, to be able to predict whether or not your patient will need braces or not in the future. And this is a very powerful skill to have. I think it's a skill that every dentist, not just orthodontists, should know how to do. Remember that our society, especially in the US, is kind of structured to send patients to the orthodontist after age 7 for an evaluation. But I think it's really, a lot of problems manifest themselves at age 2, 3, 4, 5, 6. So it's really important to predict problems when they're going to occur ahead of time, to even intercept earlier problems earlier than age 7 or 8. A lot of this interceptive treatment can be done by the general dentist or the pediatric dentist before, and they may not even need to go to ortho. A lot of orthos don't like working with little kids. They prefer till they're 12, 13, 14, but problems are so much easier to stop and turn around if they're younger. And parents more and more are asking for this. So I wanted to make this video just to show you what you want to see, what's perfect, what's ideal, and that way you know when something's not like this, you can point it out to the parent and maybe give them some remedies to be able to mitigate and make things better. So let's look at perfect, and let's say this patient lost their tooth because this typodont is missing a tooth. But this is like a perfect 2, 3, 4, 5-year-old, okay? So this is what we want to see. We want to see 6 millimeters of spacing per arch, which is what we're seeing here. So that means front teeth should have 6 millimeters of spacing. Bottom teeth should have 6 millimeters of spacing. That's the perfect amount of spacing. If the teeth are touching and you do not have 6 millimeters of spacing, your patient will have crowding when they get older. Looks nice. It might look nice now, but it won't look nice later. And you need to be pointing this out to your patients when they come in, to the parents. Just take them aside and just say, hey, just letting you know that, little Jane here, is showing signs that she's going to have crowding when she gets older. I'm just letting you know because there might be some things that we can do now to mitigate that. It's not braces or anything, but there could be some appliances she can wear at night that will help to kind of grow her mouth a little bit more, all kind of things we can do. So that's in terms of crowding and spacing, right? If you see more than 6 millimeters of spacing per arch, just probably means that they'll have generalized spacing later. That's super easy to correct, okay? So let's talk about that first. You got that down. Okay, now let's talk about transverse. Okay, so that's another direction. So transverse means width, width, the width of the jaws. So the top teeth should come out a little bit over the bottom teeth when you look at it like this. Okay, this is what you want to see, like this. Okay, if it's like this, okay, this, then that means the upper jaw is too narrow relative to the lower jaw. There's things we can start doing. Palatal expanders usually we're not placing till 7 or 8, but there are things we can start doing when they're younger. Can't promise it's going to work, but they're also very inexpensive. You wouldn't be building your D8060 or anything. You would build probably D8210, D8220, okay? But if the arch width is not ideal, we want to go ahead and catch that and get started with it. Or we can let the parent know if there's a habit, usually this is related to a habit like thumb sucking or something, that we need to eliminate that. And often when you eliminate the habit, then that improves on its own. So, all right, so that's transverse. So we talked about spacing, we talked about crowding, and we talked about transverse. What are we talking about now? Let's talk about vertical. So vertical, we want to see this, okay? We want to see midlines on. We want to see about maybe 10, 20, 30, 40% of the lower teeth covered by the top teeth. We want to see a good 50% of the bottom teeth, okay? Which is what we're seeing here, right? So when they bite down, we wouldn't want to see that. That's an open bite, right? And I can't simulate the deep bite, but you know what that looks like. That's where you can't see any of the bottom teeth when the patient bites down and or the bottom teeth are hitting the roof of the mouth. If you're having vertical issues, either open bite or the deep bite, it's gonna be like that. These are things you need to correct now. Definitely the open bite, because the open bite is usually habit related and that's a vicious cycle, okay? The deep bite also will always get worse. It will get worse and trauma can happen. So also things you might wanna start correcting now. All right, so now we've talked about vertical, we've talked about transverse. The last thing, we talked about crowding and spacing. Let's talk about AP. So AP is the part that's most difficult for parents and patients to understand, and even dentists. That's anterior posterior. So that is overjet, you know. I'd have to take, hang on, let's take this off. We love type it on, don't we? Okay, yay, I can do it now. Okay, so that would be your, hey, like your overjet. Of course, the bite isn't, it's not articulating if I do that. Okay, like that, okay? We got an overjet, see? Or your opposite, your negative overjet, right? AKA underbite. So we want to see it looking like this. This is pretty much normal in a kiddo. You wouldn't necessarily expect to see class 1 because when they lose these teeth, everything kind of slides around. Because, you know, these are bigger teeth and this moves forward because this is a bigger tooth than the premolar and everything. But this is what you'd expect to see in a kiddo. So I'm more looking at the front teeth, right? It's a teeny bit class 2E, but then we don't have molars in yet. There's no such thing as class 2 because we don't have permanent canines in and we don't have, you know, the 6s in. So there's really no such thing. So we're just looking at the front teeth, right? But this is what we want to see. If you're seeing a major overjet occurring, you know, in this 2, 3, 4, first of all, I'd be thinking habits. Second of all, underdeveloped mandible. There's lots of things we can do. Let's get started. Whoa, now we got all kind of problems. If you're seeing negative overjet, again, this is still baby teeth, so things might change, but that's a sign that either there's a habit of the functional shift or there's lack of growth of the maxilla usually in this age. And that's something that we probably want to at least be thinking about. Maybe doing some exercises. There's all kind of things we could do. There's some soft appliances they can wear at night that can help out, but definitely I'd be keeping a close eye on that patient too. So glad to talk to you more about your particular situation. My jaw just fell apart. But hopefully that was helpful for you. All right, and as always, don't hesitate to reach out. Please subscribe to our YouTube channel. Click that button at the bottom so you can get all of our videos. We try to upload a couple ones each day. We do our videos by request, so shoot us a message at StraightSmileSolutions.com. Hit the contact button and let us know what you'd like to hear. And we are super happy to talk to you one-on-one if you have questions, if you are a doctor. Patients, you can subscribe to our Facebook group. All right, thanks so much.